FAQs on Afternoons with Helen Farmer.
We are here with you this afternoon on Facebook Live, so feel free to comment there. The usual channels, of course, 4001 on the SMS, and the ARN Play app is there for you as well. Delighted to be joined now by Dr. Farida Al Hosani, the Department Manager for Communicable Diseases in the Abu Dhabi Public Health Centre. She's the official spokesperson for the health sector here in the UAE. Doctor, how are you?
Hello, good afternoon, Helen.
Thank you.
And good afternoon to the Dubai Eye audience as well.
Well, I hope you've had your coffee, Dr. Farida, because I've got a feeling we're going to have lots of questions, and I cannot thank you enough for your time today. It's an incredibly busy and incredibly interesting time when it comes to vaccines. People are at different stages in their vaccination journey. I'm very relieved to be fully vaccinated, and that to be the case for all the adults in my household. But I feel like there's still a lot of confusion and questions, and that's why we're here today. So let's get to it. And I'm going to revert back through some of the texts we've had throughout the course of the morning, and lots coming in on 4001 as well. So one that's been a really kind of prevalent one is, if an Abu Dhabi visa holder lives in Dubai, can they get the Pfizer vaccine, or do they have to be a Dubai visa holder? People seem to be a bit confused whether it applies to anyone living in Dubai or only those with the Dubai visa.
Well, Helen, I think with regards to the vaccination access, there has been always some changes that are happening between vaccine to another. Currently, the focus is really on the second dose for most of the vaccines, including Pfizer and Sinopharm, as we reached around more than 5 million doses of vaccination provided. Majority of them has been from the first dose. So currently, most of the access provided for the second dose, plus the high-risk groups from different community sectors.
I think one of the big questions that we've had this week from our listeners is asking why the vaccine numbers have been a bit lower, certainly on Sunday. Are you able to give us some insights into the reasons behind those numbers?
Well, the variation, especially in the weekends, usually tends to be less because either number of clinics are closed during the weekends, or sometimes the audience are busy in their weekends and prefer to go during weekdays. So definitely we see a trend, mostly increasing during the weekdays rather than the weekends. This is the overall observation that we could see.
Which I think makes total sense. I think a lot of people, if they're being honest, would rather go along for a vaccination or appointment on their company's time rather than their weekend. So when we see that Sunday number, I think there are a number of factors. But thank you for clarifying that. And another question we've had an awful lot of from Dubai Eye listeners is how high the death count has been. Unfortunately, over the last week or so, we've seen numbers, 14, 15, even up to 20. Are you able to offer some insights into why that might be, please, Dr. Farida?
I think looking at the overall epidemiology of COVID in UAE, we could see that the trend of cases has been showing a steady decline, which is a really very positive sign. For the death numbers are a bit increasing. Usually the trend of cases versus the deaths usually delayed in terms of the improvement. So we are currently observing very good signs when it comes to the first positive cases. That is showing a steady decline. We expect that the death usually is a bit delayed, and when you see the signs, usually it takes 2 to 3 weeks after the decline in the number of cases. So this is the overall signs are positive, and we hope to see the decline in the deaths very soon.
Well, we have actually just had the COVID numbers come through to the ARN News Centre in the last couple of minutes. We'll be looking those in full at 5:30, but I can tell you that there has been a decline in the number of deaths, with 5 more patients sadly dying, but a significant reduction since days this week. So thank you for that. I think it's a really interesting and timely reminder that there are so many variables at play, and I know there's all sorts of charts being done by people at home, and certainly here in the News Centre, and by medical bodies as well. And we know we're all just trying to get as much information as possible, and lots of people getting in touch. One here and with side effects saying, it's been almost a week since I had the second dose of the Sinopharm vaccine. I feel very tired. Is this normal, or am I thinking too much? Are you able to shed some light on Sinopharm side effects? And I can tell you, after I had my first one, I was exhausted, headache, bit of a fever, mega fatigue for a couple of days, and then second dose, no side effects at all. It seems to affect a lot of people very differently.
Exactly, and it's like any other vaccine. You expect to feel some tiredness or fever or swelling in the area of the injection, sometimes even itching in the area of the injection. All of those signs are normal, expected, and it's usually resolved spontaneously without any need for treatment. So this is totally normal and expected. Sometimes it's very hard to differentiate between whether this is a psychological thing because we are sometimes a bit worried and concerned, or sometimes it's a real sign of tiredness, which is again a common sign.
And the same with symptoms of COVID as well, because we have been living this pandemic for a year now, we kind of forget that there are other things going on. People can fall and break their ankle. You can get the common cold. And, our minds automatically often leap to symptoms and kind of put things together, 2 + 2 = 5. And next thing we know, we're getting ourselves worked up. So if anyone is out there and they've got any questions regarding symptoms, please do reach out. We've got Dr. Farida with us until 2:30 this afternoon. I wanted to ask you about different variants, if you don't mind, please. The UAE had reported cases with the UK variant, but do we have any cases, to your knowledge, of the COVID variant from South Africa?
Well, I think we have been talking to different labs regarding establishing monitoring systems for all kinds of variants. Currently, there are more than 5 different variants of public health interest across the world. Some of them are coming from Europe, from South Africa, and also we have a few variants that has been reported from US and Brazil as well. So we are establishing a full monitoring system to be able to understand the changes on those variants and whether they are existing in UAE. It's expected that those variants are available across the world. It will really depend on the capabilities of different countries to identify those variants. So we are closely monitoring this.
Dr. Farida, we are stealing you away until 2:30 this afternoon, so do stay with us. And if anyone's got any questions, please do reach out. Delighted to have the official spokesperson for the health sector here in the UAE, Dr. Farida Al Hosani, with us. We're on Facebook Live. You can feel free to put any questions or comments there. Lots of messages coming in on 4001 and the ARN Play app as well. You can, of course, be completely anonymous. If you do want to have a little chat or leave us a voice message, it's 04871 5500. Up next, asking Dr. Farida, what would you say to anyone who's sceptical about getting the vaccine, and when can we begin to see children, pregnant women getting the jab?
Join the conversation on Afternoons with Helen Farmer.
Only on Dubai Eye 103.8.
2020 will always be remembered as the year of unprecedented times. So, let 2021 be the year you remember as the year you took your business to the next level. Join the ARN Business Club and learn how you can reach half the UAE population with the UAE's largest and most trusted multi-platform network. Registration for the 13th annual ARN Business Club is free and places are strictly limited. The ARN Business Club takes place this month. Register now at radiorsvp.com or text ABC to 4324.
Get to know Avani Palm View, the brand new place to play and stay in Dubai. Chill by our infinity pool with everything you need for your stylish staycation.
Would you believe it if I said you can set up your business in under 60 minutes?
Is that even possible?
Yes! Hamria Free Zone offers a one-stop solution to make your dream business a reality. With 6,500 businesses from 163 countries and world-class facilities, including warehouses, offices, and industrial plots.
Wow! Amazing!
What's more, visit their stand at Gulf Food on Dubai World Trade Center for an incredible 30% off on warehouse rent for the next 3 years. Hurry, this offer limited to the first 5 warehouse units. Hamria Free Zone, a world of new possibilities awaits.
This is Afternoons with Helen Farmer.
With Avani Palm View Dubai Hotel and Suites. Simply the best for your long city stay. For special opening rates, visit the Avani Palm View Dubai website.
Dubai Eye 103.8.
It is Helen Farmer with you live on Dubai Eye 103.8, and we're live on Facebook too.
Healthy habits.
On Afternoons with Helen Farmer.
very, very lucky to be joined this afternoon by Dr. Farida Al Hosani, the official spokesperson for the health sector here in the UAE, as we talk vaccines, availability, variants and more. Dr. Farida, thank you so much again for your time. I want to get through as many questions as possible that are coming in both on Facebook and, of course, on 4001. But I wanted to start with this, given that we are speaking to the nation. And I feel like, we're in a time of great communication, of, WhatsApps and Facebook groups, and unfortunately fake news as well, which has fallen on some receptive ears. And I wanted you really to take this chance to offer a message to anyone who is feeling doubtful or sceptical about taking the vaccine.
Yes, actually, being doubtful about vaccine is a historical thing with different vaccines that we had, with different campaigns that we had. And it's not strange to expect that with COVID vaccine. I think with the social media platforms and with different technologies that we have, this even made it very hard for us to differentiate between what is the rumor and what is the fact. And therefore, some people might be misled by a lot of rumors or misinformation that is existing in social media. I would urge you all to take consideration, really to verify any information that you receive, and also look for the right sources of information. For the vaccines that has been licensed in UAE and many other regulatory bodies across the world, there is a very strict regulatory process of evaluation to ensure the safety and the efficacy of different vaccines. And this has been the case for COVID vaccine as well. We took a lot of time to review the data. We had done many studies. One of the current studies is still ongoing in UAE for Sputnik vaccine, as you know. So there has been a lot of stages before we launch the vaccine for the public to ensure that we have enough data about its safety and its efficacy. And now we have two choices: either to be protected by taking the vaccine, or to be at risk of getting the disease and complication. And I believe that no one really wants to face this experience of getting the infection because of many reasons. Some of it is psychological, some of it because of the risk of the complications of the illness. So therefore, I urge everyone to take the vaccine and be protected against the disease and against its complications.
Thank you. And I think it's really key to note that there seems to be no rhyme or reason when it comes to the severity that people can experience. You can be young and fit and healthy and it can hit you like a truck, so please do everything you can to protect yourselves and maintain that social distancing, wearing masks and everything we've been trying to do as a community for so long. And yes, if you can, take the vaccine. And going to the text line now, Dr. Farida, a message here saying, my parents are over 60 and were due the second dose of Sinopharm on the 21st of February. That's Seha. They were in direct contact with someone who tested positive and are in isolation for 10 days until the 25th, so that's Thursday. They've got no symptoms, but when can they get their second dose? So I think when it comes to having contact with someone who is positive, what about timings? And if you are scheduled to get your second dose, how flexible is that?
I think there is a flexibility to reschedule the timing because many reasons. Some people might travel, they have other commitments, or even because they got exposed and maybe they are worried to take the vaccine while they are exposed. So delaying the vaccine for 1 week or 2 weeks maximum is possible, and for people even who get the infection after the first dose, they can reschedule once they recover. So for this question specifically, for the parents who got exposed, they can wait until they finalize or finish the quarantine period, and then they can take the vaccine.
And one question we've had an awful lot of this week is about the numbers, Dr. Farida, about people trying to keep track of active cases, new cases, and recovered cases as well, saying, I'm a bit confused how there are only 8,000 active cases approximately, but if you look at the daily cases over the past 10 days, that add up to more than 27,000. If it takes 10 days to recover, then surely there should be 27,000 active cases. Can you explain? Can you give us a quick lesson in COVID maths and how those numbers are reached, please, Dr. Farida?
Well, I think it's really, I have to look for the latest number that has been released by the Ministry of Health. Usually, for some cases, not all of them will require 10 days. Some of them might require a couple of days, and the next day they can become negative. It depends on the cases. A majority of the asymptomatic cases might recover and might have some negative consecutive tests before even the 10 days. So the 10 days is the maximum period, not the average period.
And we've also seen a real outstripping of active cases by people receiving the all clear. So, for example, we will look at this in detail with the ARN News Centre, but the UAE has confirmed 3,005 new cases of COVID-19 today, but another 3,500 people have received the all clear. So, so at the moment there's 7,823 active cases. Another question a lot of people are getting in touch with right now is, and I think it's really positive that there is now this appetite for people want to get vaccinated, but if someone isn't in those vulnerable groups, so the over 60s, chronic diseases, where is the easiest place to go and get the vaccine of any type right now, Dr. Farida?
There are many ways that for elderly and high-risk group they can take the vaccine. One of them is to reach for the hospital they are currently taking care of, like if they have chronic conditions and following with a doctor. I prefer that they go to the same hospital. Majority of the public hospitals are currently having the vaccines. If in any case the hospital they are following they don't have the vaccine, then there are different majlises that are opened. Some of the tents, screening tents also in different emirates have the vaccine available as well to provide it for the high-risk group. People who are bedridden, for example, or they cannot go outside the home, they can request for home care service, but they are available also the service for elderly and high-risk group in different emirates. So there are many ways to reach out. Also, they can find the vaccine in the private sector, in major hospitals, in the private sector in different emirates. Also, they are participating in the campaign. I think the best way is to reach out, depending on where you are in which emirate. You can reach out to the website of the health department in this emirate, and you will find the list of all COVID vaccine centers that are available in the same city, and then you can call them and take appointment. This will be the best way to reach and take the vaccine.
Thank you, Dr. Farida. And going back to the text line to Neil saying, I've received my first dose of Pfizer COVID-19 vaccine today and would like to thank the UAE government, DHA, for excellent arrangements and ease of going through the experience. Well done. Happy vaccination day, Neil. And a message here saying, I had my second dose of Sinopharm vaccine on my left arm. First dose was pain-free, no effect whatsoever, but I'm having trouble lifting my left arm now. I feel the vaccine was administered quite high in my arm. Should I seek medical advice? What would you say, Dr. Farida? It seems like a normal side effect. When is it cause for concern?
I think if any of the symptoms persist for more than 2 or 3 days maximum, it's better that you seek a medical advice. You can go to the emergency department, or you can go back to the vaccination center where you have been vaccinated. You can also call the call centers, whether it's Ministry of Health, Dubai Health Authority, or Department of Health Abu Dhabi, and they will guide you where to go exactly. Any emergency department can help and assess, and there is an existing adverse event following immunization system that they can report and follow up such cases.
I had the Sinopharm. Sunil's here having the Pfizer. My daughter's teacher had AstraZeneca over the weekend. Any plans to start introducing the Russian vaccine, Sputnik V, to the public?
As you know, this vaccine has been already registered as part of the emergency authorization in United Arab Emirates. There is a study ongoing, so there is an option that if you are interested to volunteer in this study. Otherwise, we will be definitely announcing once we open it for just the general public.
And in terms of other groups receiving the vaccine, at the moment, if you are pregnant, planning to get pregnant, breastfeeding up to 6-month-old infant, and of course those under 16, the vaccine is not available or indeed advised. Do you see that changing in the near future, Dr. Farida?
I think yes. The reason pregnant women was not included at this stage because we don't have enough studies. Most of the global studies and also the local studies focused on the high-risk group. So that's why you see that the vaccine launched for elderly and high-risk group, children above 18, also any adult above 18. For children and pregnant women, there has been some announcement that there are currently trials started already in different countries. Like 4 days back, Pfizer announced a trial for pregnant women, and also there are at least 3 or 4 vaccine companies that announced a vaccination trial for children. So we expect that we will get some results about the safety of different vaccines for this important segment of our community. They are definitely at less risk compared to the high-risk groups, elderly, but it's important that we provide the protection for them as well. So we are all closely monitoring those studies, and hopefully we can get some results soon.
I think that's exactly right. You know, we are a young population here in the UAE, which is incredibly beneficial. So the sooner we can get more young people vaccinated safely, the better. Now, we are lucky enough, as you said, more than 5.5 million vaccines administered now. So we've now got a huge group of the population who have had the first dose, if not the second dose, which raises other questions and in some cases makes things a bit more complicated because it's not one rule for all. So people who've taken both doses of the vaccine, do they still need to take PCR tests and self-isolate if they have come in contact with someone with COVID?
Taking the vaccine might reduce the risk of getting infected, but it does not eliminate it completely. So if you are exposed for any reason with any case, it's very important that you do the test. Actually, we recommend the routine testing for everyone, including the vaccinated individuals. Therefore, for direct exposure with a positive case, it's important that you or any other individual really do the testing, and maybe they need to even repeat the testing after a period of time to ensure that they don't have, because they might have mild or asymptomatic disease.
And also worth noting, please continue, even if you have had both doses of the vaccine, to wear your masks, social distance, clean, sanitize, and everything we've been asking people to put in place and come together with over the course of the last year. Claudia's saying, I had COVID in December. Must I wait 3 months to get the vaccine?
I think there has been a variation on this again, but the most updated guidelines that we recommend the vaccine, if the type of the infection was mild or asymptomatic, they can take the vaccine after recovery. They don't need to wait for 3 months. For people who had severe, moderate or severe illness, we advise that they do the antibody test, and if they still don't have enough antibodies, they can take the vaccine.
Dr. Farida, thank you so much for your time this afternoon. Hugely helpful to get some no-nonsense advice and straightforward answers. Really do appreciate it. Lots of messages, of course, coming in on 4001 on the Air and Play app, but we're going to have to say goodbye for now. We'd love to have you back as this conversation continues. Wishing you a wonderful day and week ahead. Dr. Farida Al Hosani, the official spokesperson for the health sector here in the UAE. Up next,